Thank you for choosing the Brain and Spine Center for your neurosurgical care. My name is Amanda. I'm a registered nurse and also the clinical director here at the Brain and Spine Center. You may also interact with Pam or Joy, who are also registered nurses and part of the nursing team as you go through your surgical care. Just wanted to give you some information regarding the scheduling process for surgery and just some reminders to get you to that point. You will receive a written copy of all these instructions in the office, or they're also available on our website. We will be scheduling a medical clearance with your primary care physician to get you ready for the surgery. The purpose of that is to just perform a safety check, listen to your heart and lungs, make sure that there's no reason why we cannot proceed with the surgery. This will be done within 30 days of the procedure. Our office will contact your doctor and schedule this directly, and then we'll be contacting you with that appointment date and time. You will also get a call from the pre-testing department, and they will contact you to come in for an assessment. The nurses will go over your health history, anesthesia will speak with you, and you will also get some routine blood work done. These will all be checked and reviewed by our office. If there is any concern that arises, we will notify you directly so that we can try to prevent any postponing of your surgery. The NPO status will be addressed by the pre-testing department RNs. That will be nothing to eat or drink after midnight, typically the night before your surgery, unless you're directed otherwise at pre-admission testing when you go for your assessment. There are also several medications we will need you to stop 1 week prior to your surgery. These would include any blood thinners such as Coumadin, Plavix, aspirin, any type of anti-inflammatory medication such as Motrin, Naproxen, Aleve. We would need you to avoid these for 7 days prior to the surgery to prevent any risk for bleeding. If a collar or brace has been ordered for you by the physician, we will give you a prescription for that to be fitted for it prior to the surgery, and depending on the fitting with the orthotist, they will either send it with you or deliver it to the hospital directly on the day of your procedure. One other reminder is regarding your MRI. If you are having surgery at a facility other than where your MRI was done, we will need to have that MRI either brought to the office prior to surgery, or we may already have it from your initial consultation. If you have any questions regarding if we have your MRI disc, just feel free to contact the office. The next step in our surgery scheduling process is for you to speak with Chris, who is our billing specialist. She will verify your insurance benefits and eligibility. She will also let you know where you're at with any deductibles. Once she does that, she'll be able to discuss that information with you by phone, or also provide you a written copy if that is required, and just talk through any questions you may have so that you're fully informed of what your costs may be in regards to the surgery. She will also verify whether any type of deposit will be required prior to scheduling the surgery, and once she is done with her portion of the scheduling process, then Emily, who is our surgical scheduler, will be contacting you to discuss potential dates, and then going on to contact your primary care doctor for the medical clearance appointment. As far as aftercare, depending on your procedure, typically the follow-up would be 4 weeks in our office. Some procedures will require you to get x-rays prior to the visit. These x-rays can be taken downstairs at the Holland Hospital Imaging Center or at Holland Hospital directly. They can be done on the day of your appointment. You would just need to arrive early to allow some extra time for that. No appointment is necessary to obtain those x-rays. You just probably want to allow about 45 minutes to an hour in order to get that done. Other procedures would just require a routine appointment at 4 weeks if there was no fusion performed. Many of our patients are going to meet with Scott Toonstra or Jeff Elfrink, our experienced physician assistants here in the office. If you haven't met them prior to surgery, you will typically meet them on the day of your procedure and then see them while you're in the hospital and in the office. Both of them assist the surgeons in surgery as well. You may also be getting a call from our data coordinator regarding a national database for neurosurgery that we participate in. She may be asking you some questions in regards to your pain, your quality of life, etc. And this is for a national outcomes database that we do participate in to just measure the effect of surgery. And that would require typically a preoperative phone call and then a follow-up phone call at 3 months and 1 year potentially. But she would contact you, and if you care to participate, you can. It is not required, but you may be getting a call from Stacy, who is our data coordinator, regarding that. Some additional information regarding postoperative medications, etc. Some of the medication you may be on after surgery requires a written prescription from our office. We do need to have 24 hours notice for prescription refills, just in order to process those effectively and in a timely manner. You may also request this over the phone. Our phone hours are Monday through Thursday from 8:30 a.m. to 5 p.m. and on Friday from 11 a.m. to 3 p.m. If you are calling outside of those hours or after hours to the answering service, we cannot refill any prescriptions during that time, just for safety measures. Thank you once again for trusting us with your neurosurgical care. If you have any additional questions at any point, feel free to contact the office. We'll be happy to assist you with those. You can also find additional resources online at www.brain-and-spine.com or visit our Facebook page at the Brain and Spine Center. We look forward to participating in your care.